Good evening, everyone. I'm Akush Lapinder. It's good having you back with us. It seems the decision to create a whole new ministry to address disaster preparedness, management, and reconstruction has left some with serious questions, like where will the government get the necessary funding for it to operate efficiently? As BJ McDermott tells us, it's yet another funding requirement the finance minister's left to fulfill in the aftermath of Hurricane Dorian.
The government's point man on finance, Deputy Prime Minister Peter Turnquest, today admitting that funding the new ministry calls for a number of adjustments to be made and that some of its functions will fall under existing portfolios.
A lot of the work that this ministry will do will be coordinating more so than actually, doing things themselves. But to the extent that there is budgetary needs for them specifically, there are a number of places that we can draw from. We are, as you know, we are taking funding from the international community through donors, as well as through the contingent line of credit that we've drawn down on, as well as the Dormant Accounts Fund, where we're taking some money from that, which, as you know, when we did the legislation, was designated towards disaster relief. So we'll take a combination of different funding sources to make sure that the ministry has what it needs in order to be effective.
What the government doesn't plan to do is use the money pouring in from the international community.
Not to fund the ministry, let's be clear, but to fund the services that the ministry will provide. So, for instance, monies that may have been donated may be allocated to shelter, may be designated for reconstruction of infrastructure that is critical to the getting people back into those communities, that kind of thing. So we are very careful, want to be very careful about how we utilize donor money in particular. So I want to be very clear about that. Donor money is going towards the intended purpose of assisting people, not for public infrastructure, not for administrative costs. It's going to the people where it's intended to go.
As for staffing needs, the DPM says the plans to draw from different areas of the public service. Reporting for Jcntvnews, I'm Berthany McDermott.
Meantime, some 70,000 people in Grand Bahama and Abaco will benefit from post-hurricane waivers and incentives. The Deputy Prime Minister telling reporters a group from the international community will soon be in the country to calculate the exact number.
So they will be here on October 1st. So October 1st and 2nd, they will be flying into the affected areas to do the economic assessment. And so we should have a report shortly thereafter.
The DPM says the order is simply awaiting his signature.
The order is actually on my desk to sign. We're doing a few tweaks to it, and today we'll get a bit of clarification on a couple of points so that we make sure we have the document drafted as the Prime Minister has intended. So hopefully within, if not today, certainly tomorrow or Thursday at the latest, I imagine that we will have that order out in full detail with the details behind it as to how people will access the various incentives that are available in that order.
Abaco and Grand Bahama have been deemed special economic recovery zones for the next 3 years. While the bills are mounting, nearly $20 million needed to nurse Grand Bahama's Rand Memorial Hospital back to health. This, of course, following the tremendous structural damage Hurricane Dorian left behind that's rendered the facility unsafe. Officials now left with no choice but to close the hospital for crucial repairs.
Today, Tuesday, a group of interested parties will be meeting with the Managing Director of the Public Hospital Authority to express commitments for different projects within the RAND to bring it back to like new. We intend to do this in phases and to complete it by the end of 2019. That said, there is still an interest in a brand new facility to replace the Rand Memorial Hospital, but that decision obviously requires the consent of the Cabinet of the Bahamas.
Health Minister Dr. Dwayne Sands says based on preliminary estimates, it'll take some $19 million to fix the hospital.
We have benefited from the donation of Samaritans Purse. They saw almost 125 patients yesterday. As a matter of fact, they have, for all intents and purposes, taken over the acute care in Freeport. They have inpatients now, they're performing surgery, they have an intensive care unit. There's another field hospital in High Rock and they have been providing services to the people in East Grand Bahama. We also have the support of a number of non-governmental organizations and emergency medical teams in Abaco. So the hope is that the Bahamian health professionals have an opportunity to get their lives back together again, as a number of these organizations have committed to be with us for as much as 120 days.
Aside from the injured, health officials must also deal with the dead.
I believe that there are 2 persons in Grand Bahama who have not been identified and who remain unidentified. All the others have been identified, and once identified and their autopsy and death certificate completed, their remains are turned over and have been turned over to their families. In Abaco, the number is less than that, but I don't have the exact number.
Officials intend to give a comprehensive breakdown of how many of the dead have been identified and how many have had their autopsies completed. You're watching JCN News. Stay with us.
This segment of the news was brought to you by Alive.